Today we're going to talk about 5 things that nobody tells you about eating disorders. I'm Tanya. I'm a psychiatry nurse and the founder of Rewired Therapy and a survivor of trauma myself. So point number 1, what is something about eating disorders that is not largely spoken about? And that is the fact that eating disorders are often a trauma response. So that person has suffered either trauma in childhood, attachment trauma, or an accident, or something that was overwhelming to them that lasted either a short amount of time or over many years. And with this trauma-based eating disorder, we often need to visit the trauma in order to process that, and then we can begin to heal from this eating disorder. When we're talking about eating disorders, we are talking about bulimia, anorexia, and binge eating. So oftentimes people will have a very difficult and disordered relationship with food where they will overeat, they will undereat, and it's essentially using food subconsciously to perpetuate an abusive cycle within their body. Point number 2, people often are not aware that when there is an eating disorder at play that we're struggling with, oftentimes there are other things that we are struggling with. And the most common are anxiety, depression, PTSD, addiction, and a mood disorder such as bipolar or borderline or the like. And even looking at those 5 common comorbidities, we also see that trauma is an underlying factor with those as well. So trauma is often an underlying factor when it comes to PTSD or addiction or anxiety or depression and some mood disorders as well. So that's also something to keep in mind. For point number 3, we're going to go a little bit deeper into the role of trauma pertaining to eating disorders. So if we look at the statistics with eating disorders, there's actually a disproportionately large amount of people who have eating disorders that actually suffered from childhood sexual abuse. And so that's to say that when we've survived abuse, there are certain implicit messages that we've learned, not only that we are storing in our mind as subconscious messages, but also these messages that we store within our bodies. So let's take it all the way to the extreme of what would it look like if we existed without any history of childhood abuse or without any history of abuse. So that would look like a deep experience within the body of knowing what it feels like to have healthy love and attachment and affection and nurturing, and to have a sense of being loved and cared for within ourselves. So in a relationship with ourselves where we are accepted unconditionally. It doesn't matter how we look. It doesn't matter if we're, a few pounds overweight, underweight. Weight isn't a factor in us being loved and respected. And so that would look like a healthy relationship with ourselves and with others. And that kind of creates an inner roadmap of what a healthy feeling feels like. Healthy feelings of love and acceptance and attachment, and also of self-care and nurturance and feeling satisfied and satiated, even emotionally. And so now that we have that type of healthy dynamic, what would an unhealthy dynamic look like? Well, when we suffer from abuse, whether in childhood or later on in adulthood, that brings sensations and feelings and subconscious messages of, I'm not heard, I'm not loved, I'm not cared for, I'm not deserving, or I'm not even familiar with feeling nurtured and feeling cared for and feeling satisfied. So we already have all of these underlying sensations, feelings, emotions, and messages that we need to work through. And if we don't work through them, they come into play in our relationship with food. And think of food as nurturing, nourishment, satisfied, satiation. Number 4, we move on to the point of how do these emotions and sensations express themselves in our eating disorder? How does this actually get expressed in behaviors, and how does this come to play? So now that we've said the previous point of what does it even feel like to feel nourished, to feel satiated, to feel satisfied, to feel loved and cared for and accepted no matter what I look like, we begin instead to have this experience of I need to look perfect in order to be respected and accepted. Maybe I have a body image in my mind that, has this like perfect body according to society's standards that I need to look like in order to be loved and accepted and to feel lovable. And so that's number one. And number two part of this response is we begin to take that out in food in binging and purging or in starving ourselves. And that's telling our body, sometimes I'll allow you to feel nourished and sometimes I won't. Sometimes I will be there for you and sometimes I will abandon you. Sometimes you can, eat on Tuesday, but you can't eat on Wednesday. Or sometimes I will love bomb you with lots and lots of food and then purge an hour later, and I will reject all of that nourishment and any satiation. So it's these emotions and feelings that we're actually rejecting as well. So now we're understanding more the psychology and the somatic experience of an eating disorder. And finally, number 5, we're going to address the factor of addiction a little bit deeper because there's a huge link between eating disorders and addiction. In fact, eating disorders are often considered to be a type of addiction. When we think of eating disorders and addiction, we think of rumination, loop thinking, constantly coming back to the same concept of food, or in addiction, it's coming to the same concept of whatever it is that gives you comfort and whatever it is that gives you a sense of relief from pain or pleasure or distraction. And why does our brain respond this way? So when we come back to the concept of trauma, we understand that we're existing in a space where it's very difficult for us to feel loved and satisfied and nourished and cared for and accepted. It's very easy, unfortunately, for us to feel rejected, unlovable, unsafe, and completely lonely and isolated. So why would our brain not want to distract ourselves with addictive thought patterns, whether it's with food or drugs or alcohol, as a way, A, to distract ourselves, and B, to engage in something that gives us a temporary pleasure? And so how do we heal from trauma-based eating disorders? That's the big question. So there are 2 steps. Number 1, like anybody would recommend, seek professional help, seek medical help. And number 2 is what I focus on, which is trauma therapy. And that means we're taking a somatic and movement perspective on healing trauma. Often when it comes to CBT and talk therapy, it addresses our thought patterns and our mind, but it leaves out our somatic, deep feeling experience. And that's where somatic work comes in. So what my team specializes in is creating 10-minute guided therapies that use the body and movement and expressive creative arts and somatic and polyvagal therapies in order for our body to slowly but surely visit the very deep, painful parts of ourselves, and then visit little by little a part of ourself that we can connect with to create an inner sense of safety, of self-love, of self-acceptance, of self-trust, and all of the things that we have a very difficult time connecting with. And so going back and forth to really holding space for the grief and the loss and the isolation, and then being able to also hold space for reconnecting with the nourishment and the nurturing aspects of ourselves is a very deep somatic way of repairing and processing after trauma. I hope you found these 5 points on trauma-based eating disorders helpful and informative. Wishing you a beautiful day.